All right, it's your old friend Mr. Bagwell back again. Going to talk about our first category of disorders here. We're going to talk about anxiety disorders. What we want you to do as we're looking at each one of these is think to yourself, what are the categories that these disorders fit into? It's one of the things you have to identify on the test. The symptoms of the particular disorder, and then the treatment. How do you help out people that have these particular types of disorders? So, categories, symptoms, and treatments is what I want you to be concentrating on. There are several disorders that we're going to be taking a look at. They all share something in common, though. These are all in the category of anxiety disorders. And so, what they cause is anxiety. I know, I told you at the beginning, psychology isn't hard. But these are all disorders that cause symptoms of anxiety in the patients who are experiencing them. What are the symptoms of anxiety, you might ask? Um your heart rate increases, your breathing rate will increase, your breath will shallow out as your body tries to get oxygen. You can get sweaty palms, sweaty armpits. You can get what is called tunnel vision, where everything um kind of focuses in on one particular thought or feeling. Can be pretty scary to deal with. So there are a variety of different things that can be symptoms of anxiety, and we all feel anxiety at one time or another. Sometimes it is a very good thing if you're in a situation where that anxiety is needed. That could be a good thing. That you're having those symptoms of anxiety. What we're going to see is that patients that have an anxiety disorder, it's not that's not the same. It's not usually a situation where they need to be having those. The treatment options for anxiety disorders um, are going to vary depending on the disorder. There are anti-anxiety medications that are out there. You may be familiar with some of those names. Um, there are also uh, treatments from behavioral psychology. If you remember talking about B.F. Skinner, John Watson, and those guys, what is called cognitive behavioral therapy, exposure therapy. In certain instances, that can be used to treat this as well. So, we've got five of these that we're going to look at over the course of the next couple of minutes: panic disorder, phobias, social anxiety disorder, post traumatic stress disorder, and then finally obsessive compulsive disorder. What I'm going to do is I'm going to go through these. And then on that playlist on the YouTube page, I'm going to put the videos that usually I would have shown um, as I'm talking about each one of these to give you some examples, because I think this is better when you can see real people and patients that are dealing with these things. And so I'm just going to put those in the playlist following the anxiety disorders notes. So when you go back to that playlist, there'll be a video there of patients that are maybe a patient that's got a panic disorder or obsessive compulsive disorder. So I encourage you just to go through once you get done, go to that YouTube channel and then click on the rest of that playlist following until you get to the next section of notes. So everything between this section of notes and the next section are going to be patients or videos to help you understand what's going on with anxiety disorders. The first type of anxiety disorder we take a look at is what is called panic disorder. Panic disorder are panic attacks. You may know this is fairly common for an anxiety disorder. You may know somebody who struggles with panic attacks. Basically, think all the way back to when we were doing that initial stuff with the brain. And the fight or flight response in the body is controlled by the hypothalamus. Well, when you have panic attacks, um, that fight or flight response is happening when it really shouldn't be. It's a good thing if you're in a situation of danger that fight or flight response kicks in. Uh, but it's in other situations you don't need that. And so that's what's happening with panic disorders. That fight or flight response is kicking in, that fear response is kicking in when it shouldn't. Now, what that'll do is that causes your heart to beat really fast. It causes your breathing to shallow out. You start to get sweaty. You start to kind of feel like the world is closing in on you as that's happening. Usually, this doesn't last a very long time. Uh, but in the time period it is lasting, it is extremely intense. A lot of times this will start out just for no particular reason, and then people actually will get uh, anxious about having another panic attack, which just kind of puts you at a heightened level of awareness to where it really kind of makes you more susceptible to that. So it's kind of one of those things that can snowball out of control pretty quickly. You can take medication to kind of help with panic attacks. Um, Really, probably a more effective therapy is if you're taught to recognize the signs of panic attacks. There are certain CBT or cognitive behavioral therapy techniques that a person can learn, um, breathing techniques, even meditation techniques, things like that, where they recognize what's happening and they kind of almost short circuit that error message that the brain is sending to them, and it can help them control that. And then eventually, those will, as you learn to control that, those become less and less frequent. And so that can be a pretty effective one. I've got a great video that I'll link there for you um, about panic attacks. So be sure to check that out when you get done with this. Second type we've got are phobias. And phobia is something we all know. You want to kill a fun 10 minutes, do a Google search for specific phobias, and there are tons of different things out there. I listed a couple for you. Arachnophobia is the fear of spiders. Some of you may be looking and going, why in the world does he have that picture up on the screen? That's a little bit of arachnophobia. Acrophobia, the fear of heights. Claustrophobia, fear of enclosed or tight spaces. You can also have tridecaphobia, which is the fear of the number 13. There are just all kinds of things that are out there. Most of us will have a specific phobia or two that we kind of deal with. For the most part, that's not going to be dysfunctional like we were talking about with those 4 Ds of abnormal behavior. You're going to be able to go through life pretty normally, even if you've got phobias. There are certain phobias, though, that can make that a little more difficult. And so that's why I pulled out the last one here. Agoraphobia. Agoraphobia is the fear of unfamiliar places. Now, what that can mean is something a little different for everybody that's got it. These are people that um, can have difficulty leaving familiar circumstances. Now, that could be your town, that could be your state, that could be your country, and those things are uh, can be difficult, especially if you want to travel or experience different things. But it becomes there are extreme cases where you'll see people that are trapped in one particular room of their house. Usually for practical reasons, it's the bathroom or a room with a bathroom. But these are people that get extremely uncomfortable in those different types of environments. The treatment for phobias is the same for agoraphobia as it is for specific phobias. And it's something called exposure therapy. It's a type of CBT where if you've got arachnophobia, buy a tarantula, let that sucker crawl all over you. Now that may sound like torture to some people, but that's it. Basically, you've got to expose yourself to whatever the phobia situation is enough that um, you start to short circuit that error message that's going on in your brain. With agoraphobia, it could be venturing. Just outside that room or outside that particular place, knowing that that's going to cause you feelings of great anxiety, dealing with it, measuring your breathing, doing things like that, and then pushing forward just a little bit more. Now, that would be exhausting. It's not something that's going to go away overnight, but it is something where there can be a little bit of relief using those sorts of techniques. Got a great video for you. It's a funny video that imagines a dinner party with a bunch of folks with anxiety or phobias. So be sure and check that out on the playlist. Next type we've got is what's called social anxiety disorder. These are people that have a great deal of anxiety in social situations. So it's kind of would fit into that same category as phobias. This one, though, um usually involves social situations. So if you've got to eat or drink in front of other people, speaking in public can fit into this one. That's a lot of times when they do polls about what are people's greatest fears, there'll be something where number one will be speaking in public and number two will be death. So that can be a pretty big fear that people have. The use of public restrooms and things like that can fit in to social anxiety disorder as well. This could keep you, as far as dysfunction goes, from going to job interviews or going out into social situations, meeting people, things like that. And so that could definitely um, cause some uh, bad effects that way. Uh, Post-traumatic stress disorder is one that we hear pretty commonly in conjunction with people in the military. It doesn't have to be people in the military, though. It could be people that have been in accidents, car accidents, things like that, traumatic situations, other than that. But for the most part, we think about that a lot with members of our military. Post-traumatic stress disorder is you have something traumatic that's happened, and then there are relapses of that in situations where we're in similar situations a lot of times, or maybe not even in similar situations, where that's going to become an issue. Symptoms of this, a lot of times those people will avoid those situations where um, that are kind of the same thing that people are um, that people are dealing with. You'll see a soldier who is, uh, you know, was hit by an IED driving down the street in Fallujah, and so when they're driving down the street in their hometown in the United States, they will come upon a street that reminds them of that, and they start to feel that same anxiety, even though they're in a much safer place. People that these people can be angry, they can be jumpy, very emotionally withdrawn from people who can have trouble sleeping. Um, Owen Hunt, one of the characters from Grey's Anatomy, is one that is a television character who struggles with post-traumatic stress disorder, and so that is that's one of those things that could be a good example if you're looking for an example of that. Treatment is the same thing. What they've found is for a lot of these folks, group therapy is something that can help quite a bit. There's some cool things, some stuff to check out. I'll link some videos for you too of exposure type of therapies that are happening with virtual reality technology. So these people are able to be safely put into some of those same situations to be able to kind of experience those things and again short circuit just that error message in their brain. Last one is what is called obsessive compulsive disorder. This one's a pretty popular one in media. If you look at Best Picture winners like As Good as It Gets, the main character in there has obsessive compulsive disorder. There was a show on USA for a lot of years called Monk, where the main character had it. I've got one linked for you from an A&E show called Obsessed. Just an introduction. It's one that people affectionately refer to as the El Camino guy, and I'll link that video for you on the YouTube playlist. Basically, what's happening here is that patients will have repetitive thoughts. And that's where the obsession comes in. They're constantly thinking about something. You see from the picture there, one of the big ones a lot of times is cleanliness. Are my hands clean? Uh, to, uh, to an extreme level. Um, and the compulsions come in where there are certain actions that they have to perform to kind of make that error message in their heads go away. And so people are constantly thinking about something until they do something that makes that thought go away. That becomes known as a ritual. And so people with obsessive compulsive disorder will have certain rituals that they're performing over and over again, which is usually this is one of the things that it gets worse over time. Those disorders or those rituals become more and more elaborate. If you back into that movie As Good as It Gets, one of the things that the main character in there would do is he had to turn the door lock on his uh, front door 5 times to know that for his brain to know that he had done that. He couldn't do it 4, he couldn't do it 6, 7, or 8. It had to be 5 times. He would count, and then that way he knew, or his brain would know he'd locked the door. Treatment for this one, usually what they'll tell you to do is to try and break one of the habits that you have, doing one at a time, doing multiple habit breaks would be probably too much anxiety for a patient to be dealing with. So pick one of those things that you want to deal with, and then go to the next one. And so, like I said, I've got some videos linked up there for you of all 5 of these. So go back to that playlist, check out the different things with anxiety disorders, and then we'll get back together again for our next set.